The Nsoatre Health Centre, established some decades ago, is one of the major health care centers in the Sunyani West municipality of the Mbunu region, serving 9 additional adjoining communities. Although there's a clear increase in the population of the people who depend on it, the facility has not seen any expansion since its establishment. This is the current state of the ambulance which serves the center. The health center is forced to always rely on the National Ambulance Service to send patients to Sunyani for further medical care. Because the facility is not fully fenced, it has become the home for cattle and goats who always graze there. The medical superintendent at the facility, Dr. Prince Yebua Ajimai, has been throwing more light on the challenges.
We only have 2 wards, 1 male ward and 1 female ward. So usually you'd have children sleeping with in the female ward, because we don't have any children's ward. It's been a great challenge, especially if you have overload of patients, more patients, and you didn't know where to take them to. So at times you take them to the maternity ward. So you'd see a non-pregnant woman without pregnant condition who will be admitted at the maternity ward. Almost all our beds are spoiled. We use stones to shock them, otherwise they will be moving up and down. So we have a great challenge with regards to beds. You see animals, cows, sheep passing through our facility, defecating all around. You know, a health facility is supposed to promote health, but these feces and their urine really pollute the environment and serve as source of contaminants and breeds infection. So I think it's a great challenge.
Dr. Ajimai is therefore calling for support from organizations and the public to help address the many challenges of the health center.
But we'd like to use this opportunity to ask for a helping hand from government and any other person to help us with certain items, especially scan for our maternity, our pregnant women who come here from time to time, because we usually tell them to go to Sunyani to take scans before we can see them. It's bad when you see a bleeding pregnant woman come here and we'd have to still let the person go to Sunyani to ascertain what it is. We also need motor bicycles to go to very remote areas, the very remote areas we have where we can't drive to. We started a structure to put out a structure for children. That structure was to serve as a children's ward, but we reached a point where we couldn't continue. We were being held by a family, but they couldn't continue anymore. So it's more of it's been abandoned. So if you can get donors to come and help continue the infrastructure for us to at least admit children and see our children, it will be very great.
The facility has received support from the Godfrey Donsa Foundation belonging to Ghanaian international footballer Godfrey Donsa. The executive director of the foundation, Hannah Chema Donsa, has been speaking to Citi News.
We realized that the Bono region health centers are facing some challenges. That is the reason why we brought these things here for Nsoatre Health Centre. And we have another container coming from outside. We have a lot of things inside. We have sports equipment. We have hospital equipment like these two. So we will deliver them in May, June, when our honorable patron, that is Godfrey Donsa, comes to Ghana for his holidays. They should use this equipment very well, so that when we get another equipment too, we will bring it to them.
From the Nsoatre Health Centre, I am Michael Saponinfum for Citi News.